Officer of the International Pharmaceutical Federation next. And Catherine is hoping to share with us some examples from pharmacy and how pharmacy has been affected across the globe with the pandemic. Welcome, Catherine.
Thank you so much, Mojgan. Thank you, everybody. Can I just check that you can all hear me?
Yes.
Perfect, great. So I'm going to try and keep to time. So I will skip through these slides exactly as the other presenters have. If you could go back to the slide before. I just wanted to tell a little bit to colleagues here. I'm a pharmacist known to many on the call and known to many of my colleagues who have presented before me. So I'm delighted to be able to present today. I am Chief Executive Officer of the International Pharmaceutical Federation, which is based in The Hague. It is a non-governmental organisation in official relations with the World Health Organization since 1948. And we signed a specific memorandum of understanding with WHO last year, pertaining to matters around workforce, medicine safety, and issues around access to medicines and supply chains. Next slide, please. The problem and the FIP response to the problem at the beginning of this year was following the WHO declaration of the outbreak as a public health emergency of international concern at the end of Jan. We needed to respond to provide support, guidance, networks, events, and advocacy. I may mention, colleagues, that we have more than 150 national member organisations, more than 170 academic institutional members, and we have scientific member organisations and about 4,000 individual members. So there was a lot to share and a lot to support. So we set up a task force immediately to develop emergency guidelines to support the workforce wherever they worked. And the guidelines have been updated 3 times since. And I think that's something that we all note, that this is not a one-off event. This requires us to update and learn as we go, which is it's quite a demanding skill set. The task force included representatives from all practice settings, including hospital pharmacy. I mentioned that here because community pharmacy has just remained the gateway throughout all of this to primary healthcare. The guidance is available in 15 languages and includes clinical information and treatment, guidelines for pharmacists and the pharmacy workforce, frequently asked questions and myth busting, which has proved to be hugely important, COVID-19 additional resources and summary guidance sheets for specific areas of work. We also developed a dedicated web page and a resource centre. Next slide, please. There's a picture of the web page. And you can see people can have a fast click. This is not just a member resource, this is open access. So creating some information for patients and the public in different languages has also been really valuable as well. Next slide, please. We also knew at FIP, we had planned 2 regional conferences in Southeast Asia and in Africa. We had a global congress on science planned for Montreal in May, and a global congress in Seville. These were not going to happen at various points in the year. We had to make decisions to postpone and cancel various ones of them. But in addition, we knew that the COVID guidance we were producing required some kind of digital support. So we set up a program of digital events called Responding to the Pandemic Together. We set up an online platform on Facebook for pharmacists and also pharmaceutical scientists to discuss and exchange queries and experiences, with more than 30,000 pharmacists accessing this. And a repository of valuable resources developed by our member organisations and allied partners. We also issued statements and scientific, technical or professional positions on various issues, which I will come to in a short while. I mentioned earlier on the things that we had to adapt during the year. Our global congresses, for example, we ran our virtual event over a 2-week period, preceded by business events held online. That culminated in World Pharmacist Day on the 25th of September, and we'd extended that into World Pharmacy Week, where we could celebrate what the profession had done, and also, quite soberingly, recognise those who had lost their lives to COVID in the profession as well. Our programme of engagement, therefore, has had to change very, very rapidly. And I don't know that we will lose all of that as we move into any kind of post-COVID world. plus the fact we don't know quite when that will be. But we kept to the fact that we had points in time where we delivered and launched various items and programs and publications. Next slide, please. Some points then, very quickly. Advocacy. We advocated to governments and international organisations for the role, the safety and appropriate recognition of pharmacists, pharmaceutical scientists and educators. We issued a call to action to support pharmacists and pharmacy workers on the front line, including 23 urgent measures that governments and other stakeholders must put in place in order to ensure the continuity of pharmaceutical care. We've heard that really from previous speakers talking about supply chains and the fact that people still needed their usual medicines, even though there was a pandemic going on, and that pharmacies remained open during this time. So this was really, really important for us. Next slide, please. Some of the measures included that pharmacists and pharmacy staff are recognised as key health workers, and that there would be appropriate resources put in place, including access to PPE. Pharmacy staff are included in the groups of healthcare and essential workers to be tested for COVID-19, and medicines at risk of shortage are identified and mitigation plans put in place. We also pushed for continued education, infectious diseases and emergency response being funded. We also included a statement of principle on the impact of COVID-19 on health equity and vulnerable populations and patients, and this was really important. Community pharmacies, actually I must say, colleagues, that we issued a joint statement with the World Health Professions Alliance in addition, which really raised the profile of pharmacy amongst all health professions as stepping up and stepping into the space. And I think the examples you've heard before from the previous presenters have really showcased how pharmacists have stood shoulder to shoulder with the other health professions, but also how other health professions have stepped in as well. So everybody's playing their part in this. A little bit of showcasing to be done, because in many countries, community pharmacy in particular, because it is classified perhaps as more retail, may not be recognised. But they represent the first point of contact within the health system for many communities. They play an important educational role. We really found that pharmacists had to provide a lot of advice to their patients and the public, and this advice could be changing on a daily basis. In many countries, pharmacists partnered with the government to ensure optimal supplies of face masks, and in several African countries, we had examples of roles played by pharmacists, such as educating populations on safety, infection prevention recommendations. They were regarded as community health leaders in their local communities, and they were accessible for advice. Next slide, please. In the face of shortages, the pharmacists that we have engaged with were also called upon to participate to ensure adequate supply, not just of medicines, but of health products and devices. And studies have evaluated, for example, among Egyptian community pharmacists, the majority of respondents reported high rates of PPE and medicine provision and mass distribution. So we saw the same issues across all of our regions and countries, but we saw them with different amplifications. We've also had examples of the US and Brazil. Hospital pharmacies and pharmacists have played a crucial role during the pandemic to ensure adequate storage and supply of appropriate stocks of medicines and other medicinal products and devices, really getting into the details of provision of thermometers, goggles and other necessary equipment, ensuring these products are adequately supplied by the hospital pharmacy, and collaborating with other health professionals. Next slide, please. We also saw examples and have examples on our website, which everybody can access, promoting hospital prevention and infection control, informing and counselling, and ensuring the responsible use of the pharmaceutical products. The pharmacovigilance and monitoring really accelerated during this time. And I have to say that in the early stages, when we found countries at different points in the pandemic, for example, colleagues in Italy were able to showcase and share once their crisis had abated somewhat with colleagues who were just entering their crisis. So this was very, very helpful. Next slide, please.
You've got 1 more minute, Catherine.
That's perfect. We saw lots of publications around this, and I have to say some of our colleagues really pushed their publications out. Next slide. You can see the slides, I don't need to read these for you. And also at the forefront of the outbreak, our colleagues in China formulated and launched a series of emergency plans to help us with guidelines. And they developed a pharmaceutical framework for hospitalized patients. That's on the next slide, actually. And it's a schema, which of course may be very familiar to us in the UK, but this was really important because they'd learned from the hospitalized patients confirmed with COVID about how to manage them and then how to adapt this for other patients. Next slide, please. Again, another publication around the drug supply and pharmaceutical care management so that others could learn from it. Next slide, please. And then some examples from our educators in pharmacy. A very speedy rapid response survey was issued, and we compiled innovative case studies from this survey, published in a journal called Pharmacy Education. And this was available for others to learn from. So our academic institutions could support each other through this time. Next slide, please. We had 371 valid responses from universities providing pharmacy initial education and training programs. This is particularly important when we think about the workforce, and we know that even in the UK, we're struggling with the registration of newly qualified pharmacists and getting them on the register so they can fill the gaps. We had responses from 63 countries in this regard. Next slide, please. The wider research urgencies in education included outreach to more regions, including low to middle income nations, continuing the upward trend in IT and digital evaluations, and how are we going to blend experiential learning, which requires these juniors and students on the wards or in shadowing roles when those pharmacists may need to be shielded or may need to be focusing on their urgent tasks. Next slide, please. Conclusions. The pandemic has highlighted the importance of community hospital. In some countries, we have pharmacists who are called clinical biology pharmacists to ensure continuity of supply. Medical devices is super important in this area, and also their optimal use. After the pandemic, whenever that will be, colleagues, it is paramount that the services we deliver and the value that they contributed are maintained. And we're working with our countries to engage with their health ministries to make sure that any investment or any regulatory changes are maintained after the pandemic, and that lessons can be learned and shared across academia in similar ways during the pandemic. That was super important. For FIP to be flexible and adaptable enough to move to a digital and virtual set of provision has been hugely important to remain relevant, important and essential to our global network. Next slide, please. Thank you for your attention.